Hello dear viewers, and welcome to another episode of Daily Reset, where a new chapter of your life starts with us. But before that, how about we take a quick break and we'll be right back for this very interesting episode. Till then, just stay with us and we'll be right back. Hello dear viewers, and we're back again after that short break, and today we have a very special guest and we're going to talk about gums in general. But before that, let's introduce our guest. His name is Dr. Tariq Almustaqi, and welcome to the show.
Thank you so much for having me today.
You're welcome. So could you give us a little bit of rundown, like a short CV of who you are, where you're working, and your profession?
Yeah, of course. So currently I'm working as a periodontist in the Ministry of Health at the Middelgar Specialized Center. I did my undergraduate studies at the University of Missouri, Kansas City in the US. Came back to Kuwait, worked for a few years, and then pursued my specialty and master's degree in periodontics at Virginia Commonwealth University, also in the US.
Very lengthy CV, but very awesome. We
Thank
do wish you the best. All right, so we're going to talk about gums today, but before we get into the details, what is a gum? What is its function? And in general, what is a gum?
Of course. So I'm going to kind of take it back a notch as well and describe how the teeth are set up in our mouth. So you have your jawbone, upper and lower, and you have the teeth that are embedded in the jaw. You have the periodontal ligament, which keeps the teeth in place, and all of that is covered with our gums. So gum is kind of a common term, what we refer to as soft tissue, and that surrounds all our teeth and the inside of our mouth.
All right. So now we're going to get into the detail about bleeding. So gums that bleed. So why do gums bleed in the first place?
Yeah, so the cause of bleeding is essentially inflammation. And the way that happens is if we have bacterial accumulation on our tooth surfaces and around the oral cavity, then that and there's lack of home care, lack of proper hygiene measures, brushing and flossing, that can precipitate into the gums and lead to bleeding.
All right. So is it ever normal for gums to bleed when brushing or flossing?
I wouldn't say it's normal, but if we're being realistic, you're always in a state of in-between inflammation and health. And for example, if you skip flossing for one day, then maybe the next day you come in, you floss that one area, it can still persist in bleeding. But in general, any sign of bleeding is a sign of disease. So it's not a sign of health.
All right. So basically when you're saying, like, for example, if I keep flossing and it keeps bleeding every time, then it's a problem. It could be a disease. Same thing goes with brushing.
Correct. Yeah. Okay. If flossing and brushing alone are not treating, or you're not seeing any resolution in the bleeding over time, then there might be a deeper underlying problem.
Yeah, because sometimes people think, like, every time I brush my teeth, it's like I'm actually, like, let's say, scratching the gum and I'm making it bleed. But sometimes the gum bleeds between which is the surface of the gums, like between the teeth.
Of course. Yeah, so the act of flossing and brushing should not cause bleeding. If your gums are healthy, you're taking care of them, you're getting your regular visits, you're on top of it, then they shouldn't really bleed. Now, you mentioned scratching and all of that. That's why, as dentists, we typically recommend using medium to soft toothbrushes. So the act of using a very rough, hard toothbrush can potentially cause some trauma to your gums. But again, generally speaking, if you have healthy gums, they should be little to no bleeding.
All right, so what causes gums to become inflamed or sensitive?
Yeah, so at the kind of a basic core, essentially the core of it is the bacterial buildup. So you eat, your oral cavity has kind of a local resident of bacteria that is always there. But add in food substances and lack of mechanical brushing and flossing, that kind of bacteria then accumulates. They reproduce, get bigger, and their presence within the gum tissue and around the teeth causes your body to react in a way that causes inflammation and eventually bleeding.
All right. So how can you tell if bleeding is serious or temporary?
Good question. So like I said, within a normal range, some bleeding is expected. No one's perfect in terms of their oral hygiene.
Sure.
But when it's excessive, when it's happening throughout the day and not just when you're brushing or flossing, maybe you're eating some food and you notice some blood on it, or when your gums visibly look red and puffy and people starting noticing, I think there's your level of inflammation is maybe more advanced and you should have professional care.
That's what I always tell people. Like, if you start eating and you bleed, then it's a problem.
That's not a good thing.
That's not a good thing. I mean,
That's not a good
brushing,
sign.
okay, it makes sense because you're trying to remove whatever debris is between your teeth or bacteria, and then you bleed. It's okay. It creates kind of a gap. Like, gaps go away, and then bleeding will start. But if you're just eating normally and then you start bleeding, that's a different story.
It's usually not a good sign. Yeah.
Right. So, can brushing too hard really make your gums bleed? As you said, that's why you use soft to medium rather than using the hard or plus hard kind of.
Correct. Yeah. It's honestly not about force. It's about applying proper technique, being consistent with it. You know, not brushing just once a day. You know, giving enough time. We recommend brushing for at least 2 minutes, followed by flossing, or flossing preceding the brushing. There's not really big difference there, but it's about staying consistent with it, making sure you're applying it to all the tooth surfaces and not missing any certain spots.
So then why do some people's gum actually bleed and some not, even though if they do brush hard?
Yeah, so I'm gonna kind of take a step back. So when we talk about gum inflammation, there's in a way two kinds. There's gingivitis, which is our basic kind of bleeding gums that is again associated with buildup of bacteria and plaque. And we have what we call periodontitis, which is periodontal disease. Now that type of disease not only involves your gums, it involves the underlying periodontium, the bone, the PDL, the periodontal ligament, all the supporting structures that keep teeth in place. So some people generally have a genetic predisposition. So you have to have the presence of the bacteria, but then if you are generally more susceptible to it, then you can have the disease advance more in your gums, in your mouth.
But then again, there are people that actually have sensitive gums, like they're born with sensitive gums, and this is where you recommend them to actually use, let's say, softer kind of toothbrushes. But what about some people that actually, like, even though they have very sensitive teeth, but they do need to use, like, let's say, a medium kind of brush because they do tend to feel like, I still didn't get that last meal out of my teeth.
Yeah, so that's kind of what I'm trying to hit at. Is it's not about being aggressive with it. I think for all cases and all people, they should aim for that soft to medium, not ultra soft, not too soft, because we do have extra soft toothbrushes that we use post-surgery, for example. But if you say within that soft to medium range, I think you have enough thickness in the bristles to clean, and you're not risking damaging your teeth or your gums.
All right. So what other symptoms often come with bleeding gums?
Yeah, so if you're talking about the advanced stages of disease going into periodontal disease, then you might start seeing signs of teeth kind of being loose. You know, if we're talking about elderly patients maybe with diabetes or other systemic conditions, you might start seeing some factors precipitate into that as well. But generally speaking, it's spontaneous bleeding, bleeding on touching, and loosening of teeth, and maybe general pain in around the gum area.
All right. Do we actually have to use, other than brushing our teeth, do actually, like, how can I say this? Let's say mouthwashes, do they actually help with the gums?
Yes, I would say that they definitely help and aid with the overall home care. In my personal opinion, I think it's not an essential part of your routine. It's something you can definitely add. There's several different kinds of mouth rinses that we use. Some we prescribe specifically for certain individuals. Some you can use on a daily basis.
I'm asking you that because there's some people that are lazy of basically brushing, and they just basically use the mouthwash and just go out. And they say, no, it's good for the gums, don't worry. Okay, but what about the teeth? So is it actually a good way of taking care of your gums, just using mouthwash? It's
more of a supplemental aid than a core essential thing that for you to need to do. If you brush and floss properly, then you don't really need mouthwash, and mouthwash certainly does not replace brushing or flossing.
All right. How about we take a quick break and we'll be right back continuing this topic. All right, dear viewers, a short break and we'll be right back. And we're back, dear viewers, after that short break, and let's continue our topic with Dr. Tariq. So, what's actually happening in our gums when they bleed?
Yeah, so again, this comes down to the process of inflammation. When there are bacteria present and around our teeth, on our gums, our body has to respond to it to fight them off.
Okay.
During that process of inflammation, there's a huge influx of different cell types, proteins, our blood vessels expand, and that's how you get more bleeding.
So it's kind of like a defense mechanism of your body, basically trying to attack the bacteria in that spot. So when you basically brush it, that flow, that massive flow of proteins and let's say white blood cells, they all try to push out.
Exactly, yeah. So that's why the core of, at the kind of essential part of removing that initial stage of inflammation is the mechanical removal of bacteria by brushing and flossing. So once you do that, you kind of limit our immune response and inflammation dies out over time.
Interesting, got you. So how does plaque buildup trigger gum inflammation?
Yeah, so plaque's always there. It's in the mouth. It's kind of always there. When you eat food, drink, whatever, then you're adding more food for the plaque to eat on and grow and progress. That's why you're recommended to brush and floss and keep it at its baseline of what it's normally used to. But when we get to more advanced periodontal diseases, then that's when the genetic factors and the patient's susceptibility comes into play. That's when, in some cases, you get people with exceptional oral hygiene and home care, yet you still see signs of progression of disease. And that's because they have a kind of a hyperreactive response. When we're talking about that inflammatory response, they react in an abnormal way that leads to further tissue destruction and development of disease.
So my question would be like, what is plaque? If you're saying that plaque is always there, then what is plaque and is it essential to your teeth?
Yes, so plaque is essentially like a common word for bacteria, or it's like a bacterial community. So they're always there, they live there, they work together. Exactly, our residents, they're part of your body. Some are beneficial. You need them in certain amounts to maintain the balance within the oral cavity. But when you introduce foods or when you have a systemic condition that's throwing things kind of out of whack, or you're smoking, or that's when the threshold is overthrown and you get imbalances that can maybe allow the less commensal, less nicer bacteria to grow in their place that can cause disease.
So could we say that smoking is the worst thing for actually building up a lot of plaque, or is there something worse than it?
Smoking is definitely the worst when it comes to your dental health in general. There are...
But if we focus on plaque itself.
Yeah, so there's countless studies showing the effects of smoking on dental plaque and the progression of periodontal disease, gum disease in the mouth. Now, it's not specific to just the plaque. Now, like I said earlier, we need the plaque for the disease to happen. But yes, there's been studies showing that smoking can allow certain bacteria to grow that they otherwise wouldn't, that help make the disease even worse.
All right. So what's the progression from healthy gums to bleeding to disease?
Yeah, so we start with healthy gums. If someone with great home care, they're doing everything by the book, no bleeding, no nothing. You remove that factor, that brushing and flossing, let's say for a couple of weeks, you start seeing signs of inflammation. First few days, maybe it's just like a little bit of your gum line. After about a week, it's a little bit more progression. Within 21 days or so, you can start seeing puffy gums. Discomfort, bleeding spontaneously, maybe not even just with brushing or flossing. And then if that state persists, and like I said, you have that genetic susceptibility, then we move on to the periodontal disease, where it's irreversible at that point. And our goal there is more to manage it than to cure it completely.
All right. And people don't realize that basically most of your health starts with your oral. Like if you do have a disease in your mouth, it actually will go down to your digestive system.
For sure.
Or trachea.
Yeah, I think people maybe view oral health as a luxury more than as an essential part of your maintaining your whole body, because you can think of it all as on its own as an organ, just like you would treat your heart or kidneys, and definitely maintaining your oral health, especially since it's a pathway to the outside environment as well as to our body, is truly essential for
because
health.
of people that don't have awareness, they kind of separate the oral from the digestive.
Exactly.
They think that if you take care of it, as you said, as a look only, then you're not actually taking care of it. You're just taking care of it as a look, like how white it is or how clean it is. But then they forget the gums, and then still you're bringing it down to your digestive tract.
Exactly, and that's an excellent point as well, because we do look at aesthetics and how teeth look. But I think if I were to name the 3 top things that we look at when we're treating patients is function, health, and then aesthetics.
Yeah.
So the looks, as important as they are, especially for your front teeth, you're smiling and all that, to me it comes third, because you need first healthy teeth, healthy gums, healthy support that'll keep your teeth in place, and then you want fully functioning teeth that you can chew on and be able to live your life with. And then the looks and the aesthetics to me come after.
It's like you're building the basis to get to the aesthetics.
Exactly.
So how do certain medications increase bleeding tendency?
Yeah, great question. So there are specific drug classes or medications that have direct associations with gums. Some calcium channel blockers, which are used for hypertension, some anticonvulsives, so people with seizure disorder, some medications used for that can cause a reaction within the gums that make them actually bigger and puffier, and there's like a huge ingrowth in the cell. Now, when you have that on its own start covering your teeth, it makes the home care, the brushing, the flossing much more difficult.
Yeah.
So you're getting more accumulation of plaque that can lead directly to inflammation and progression of disease.
Pregnancy and gum bleeding.
It's a big one.
Yeah.
So, as we know with pregnancy, there's a kind of imbalance with the hormones, or like an increased influx of certain hormones within the female body.
Yeah.
And there's been studies and incidences show that due to that increase in progesterone mainly, which is one of the female hormones, you get increased permeability, increased vascularization within the blood vessels, within the gum tissue, that could potentially lead to more bleeding, and we actually call that pregnancy gingivitis.
Gingivitis, yep.
Yeah.
I used to hear people say like the reason why that happens is because when a woman basically is pregnant, usually the child is trying to pull all the hormones so that he can be complete. At the same time, he's pulling all the calciums, the vitamins, and everything. Is that also part of it? I
wouldn't say it's directly correlated with that. I mean, I know that the body goes through so much, having, being pregnant and feeding a child as well as yourself or a fetus. But it's mainly the disruption of the hormones and the reaction of the blood vessels and how they precipitate within the oral cavity that can cause to increased bleeding and inflammation.
All right. Interesting topic, Dr. Tariq. How about we take another break and we'll be right back.
Of course. Thank you.
All right, dear viewers, another break and we'll be right back right after this. And we're back again, dear viewers, and let's continue our topic. So, doctor, what's the first thing someone should do when they notice that their gums are bleeding?
So, this is going to be a recommendation in general for all people of all kinds, whether they have bleeding gums or not. You should always see a doctor at least twice a year.
Okay.
Because if you do that, especially without having initial problems, then if there is something that might be developing, whether it's bleeding gums or cavities or whatever, then the doctor can see it and catch it ahead of time, and can recommend certain protocols or procedures for you to do.
Okay.
So definitely at the earliest sign of gum bleeding, I wouldn't say you need to go to the doctor right away. Maybe look into your own home routine. Am I flossing well? Am I brushing well? Can I make that better? Can I do a better job at that? And if you start implementing that and then give yourself a couple of weeks and see the effects of that, if there's resolution, then good for you. You're probably in a good position. If there isn't, then I would go seek
medical help and
medical help.
Okay. What if, for example, it's let's say 9, 10, 11 p.m. and my gum started bleeding excessively? Is there something I could do to stop it till the next day in the morning, since usually maybe I'm in a place where there's no emergency, let's say emergency dental facility or section?
Right. I mean, I do believe we do have emergency clinics that you can visit.
Yeah, we do.
I would say spontaneous bleeding to that extent is very unlikely unless you've had a dental procedure done within a couple of days maybe. So if you've had a medical procedure, especially a surgical dental procedure, then you should definitely seek attention right away, whether it's the emergency clinic or back to the doctor that saw you. Definitely do that. Now, when it comes to bleeding on its own, a basic, easy way that people can do at home to stop bleeding is just pressure.
Pressure. Okay.
So we use cotton, gauze. Hopefully the dentist, your doctor gave you something that you can use at home, and just apply good constant pressure for 15-20 minutes. And typically that should
we can
help.
treat it like an outside wound, which is just putting pressure on it until it just either subsides until I get a medical attention.
Exactly.
All right. So how can proper brushing technique reduce gum bleeding? And can we talk more about techniques? Like, what are the specific techniques that you would actually advise our dear viewers?
Of course, yeah, and that's something I love to do, like a show and tell with a lot of my patients, and people of all ages. After years, they're like, oh, no one's ever shown me that, or that's not how I've been doing it. So again, like I said, when it comes to brushing, it's not about how heavy you do this or how aggressive you are,
and what type of doesn't matter how hard the toothbrush is. Also.
Exactly.
Soft to medium.
Yeah.
All right.
Now, my recommendation is we are in an era of technology, is to maybe invest in an electric toothbrush.
True.
It's definitely life-changing, and with the way technology has improved, it has also done the same in the dental field. Now, having said that, the basic goal is to cover all tooth surfaces. So you have the chewing surfaces, the cheek side, and the tongue or the palate side. Yeah. So you definitely want to make sure you cover all these surfaces. You also want to make sure that you aim your bristles, your brush bristles, towards the gum line, so that motion, whether it's circular or a bit side to side, can go underneath the gum line a little bit and clean the bacteria in that area.
Okay.
And one other thing I also tell my patients is, don't do it randomly. Don't just take a toothbrush and then just go at it different areas. Have a routine. So maybe start with the top right, do all the front side, and then do the back side, and then go down, do the same thing. That way you're covering every single tooth, you're not missing a spot.
Every surface.
Every surface, and you're giving yourself enough time to brush.
So the dentist would always tell us, like, as you said, like to brush it towards the gum, right? What about the circular motions? Is this also very effective?
Yeah, like I said, it doesn't hurt. Again, if you look at the literature of brushing and flossing, there's several different techniques that are named after specific people. Some have been built upon. So there you have Charters, Bass, Modified, Phones, and they typically had different uses. But what they found over time is it's the actual mechanical act of brushing, whether you do it a little bit more circular or more, left to right, as long as you're covering all the tooth surfaces and you're aiming towards that gum line, then you're going to be doing a good job.
All right. So can you share how treating bleeding gums prevents serious complications?
Yeah. So the biggest, most severe complication of persistent bleeding gums is progression into periodontal disease, and that's when you start eating away at your gums, your jawbone, and you start losing teeth. So that's kind of the end game of gum disease, is you lose your teeth. They start getting loose, they lose that support, and then you lose teeth.
Yeah.
And it starts with the basic brushing. Again, as long as you have good oral hygiene, you have regular dental visits, because sometimes, like I said, once you've progressed into that periodontitis phase, then brushing and flossing alone is not enough, and you need more professional help in the term of maybe professional cleaning or some kind of interventional procedure, be it surgery or not, that would require to take you to that next step of health or treating it. If you have any underlying conditions, diabetic, if you're smoking, maybe taking certain medications, I would say be aware of what you're taking. Educate yourself, especially if it's something that you're going through your own body, and don't shy away of revealing the other conditions that you have to your dentist, because they all play a role and are connected.
Yeah, they're all in one synchrony, as they say, they're synchronized.
Exactly.
A question would be like, could you give us a personal, let's say, experience of someone that you've seen with very bad gum, and you've helped him or her get through it.
Yeah, so I'll give you two examples on kind of opposite ends.
Okay.
So in this, when I was studying during my residency, we had a lot of individuals that maybe did not have sufficient funds to go to like implant dentistry and all that, so they wanted to save their teeth for as long as possible.
Okay.
So like you said, we're talking about severe cases where these teeth have lost more than 50% of their support. They're barely hanging in there. You know, a lot of them are mobile. They're at that end stage where they might be needing to be extracted soon.
Yeah.
So we take them through a kind of a treatment plan. Initial phase starts with, you know, obviously diagnosing and all of that, but patient education. You know, expectations, what you might expect, what you need to do to improve on. If you're, again, smoking, quit smoking. You need to improve your home care. And then we take them through a series of scaling, deep scaling and deep cleaning, and we're removing, kind of giving them a clean slate. Now, for a lot of these patients, it doesn't end there. You have to intervene more surgically at that point and do more of a surgical cleaning, and sometimes smoothen the bone and allow the gums to kind of heal on a nice clean baseline.
So they can clinch on the bone.
Exactly,
okay.
exactly. And then sometimes if there's teeth are moving or mobile, we might even have to kind of splint them together.
Okay.
To prevent extra mobility and maybe give the patient a little bit more comfort. So that's one way we might want to maintain teeth that are considered with a poor to hopeless prognosis, but just to kind of buy more time for the patient before moving to the final stage of removing them. On the other aspect of that, again, patient with similar, you know, presentation, severe teeth, hopeless, kind of beyond repair or beyond saving them for long term, we can take them out and move straight into implant dentistry, where we place dental implants and give them implant-supported prosthesis.
All right. Any advice would you give our dear viewers in the term of awareness and not to shy away to go to their dentist?
Yeah, so again, whether you have a problem or not, please visit your dentist every 6 months. If you are healthy and doing things, then your visit is going to be short. They might do a couple of x-rays, take a quick look, maybe a quick cleaning if you need it. And that'll be the best and fastest way to prevent future progression. And then stay on top of your home care.
All right. Hey, thank you so much for your time, doctor, and we hope to see you in another episode.
Thank you so much for having me.
Welcome,
Appreciate
anytime.
it.
All right, dear viewers, we've reached to the end of today's episode right here at Daily Reset, where a new chapter of your life starts here. And today we did talk about gums, and we hope that you actually took really good informative information about this. Until next time, see you soon.